let's take a look at the anatomy of a low back. Okay. That's an important bone. It's called your sacrum, and it is basically the fusion of your last couple of vertebrae. You have 5 what we call lumbar vertebrae, and if we look at them, you can appreciate like the uniqueness of their shape and the curve that they have. Okay, a natural curve. A couple really important things about the low back. It's the connector of your pelvis and your sacrum to the rest of you, to what we call your axial skeleton, meaning your spine and your rib cage. And for some reason, when folks get stressed or folks get they don't get a good night's sleep, most of my patients, that manifests itself in pain in their low back. So it is absolutely real, the pain that you are feeling, if you're feeling any pain, but it's complicated and it's likely multifaceted. So the anatomy is important, but the really understanding of why it's hurting you is probably more important. So I want to show you the muscles, and let's add all of them in. Okay, so this is really important just to see, like, okay, we have our glutes, and we have our lats, and we have our upper trap here, and we have a lot of things that connect these places. So let's take away a layer of muscle or two, okay, and let's keep taking muscles away. Okay. Let's look at this guy, which is called your quadratus lumborum. Okay, thankfully all these muscles have pretty good Latin names. And let's show you what it does. Oh, I don't want to do that. There we go. Okay, let's show you what it does. We'll zoom out. Oh, and it basically turns us side to side. Okay. It is almost impossible for us as physical therapists to isolate a single muscle in your low back. We can target them, but look at all of the anatomy and tell me, how are we going to pick one single muscle to start to activate? We can't do it. Okay? It's not the way our body moves. It wasn't the way our body was designed to move. So that's the muscle component of our low back. If we take that away and I show you the ligaments, it's going to show us our kidneys in there too. Okay, but in between each vertebrae, you have these ligaments. Then connecting the top vertebrae to the bottom vertebrae are these ligaments. And then we'll get rid of that. Okay. And then you have this long one, right? Your anterior longitudinal ligament, or ALL. That sits in the front. And then you have a posterior longitudinal ligament. I don't know if I can show it to you on here. It might be hard to... There it is. Okay. So just like all of your other bones, like your bones in your spine have these ligaments to try to keep them in place. The difficulty with a human spine is that it connects and it serves as the base for pretty much all other movement that we do. Any movement of our hips, any movement of our arms, we need a really strong, stable base to do that. So I hope this helps you appreciate, like, there's a lot of anatomy that goes on in a low back, and it's a multifaceted, multifactorial approach when we start to treat one. Okay? I appreciate you. Thank you for spending your time and your attention with me today. Keep moving and keep getting better every day.